Rural America is facing a full blown maternity care crisis, and no one's coming to help. More than half of all rural hospitals in the United States have no labor and delivery services. And the ones that do, nearly 200 of them are at risk of shutting down maternity care entirely. These hospitals aren't cutting services because they want to, they're doing it because they're losing money every single time someone gives birth. So here's the financial reality: Medicaid pays for over 40% of births in rural areas, but it reimburses less than what it costs to provide that care. So that means hospitals lose thousands per delivery. In fact, even if a rural hospital has a fully staffed maternity unit, it can still lose money just by keeping it open. So this isn't just bad business, it's a public health disaster. When rural hospitals close their OB units, families are forced to drive over an hour to the nearest delivery center. That's dangerous. Maternal and infant mortality increases, preterm births increase, C-section rates go up, and rural Black and Indigenous women, they face the highest risk of death and complications. So even when hospitals try to keep their services open, they can't recruit and retain OBs, midwives, or even anesthesiologists because the pay doesn't match the risk and the funding simply just isn't there. So this isn't truly a workforce problem, it's a payment problem. There's no current federal payment system that guarantees maternity services will be sustainable in rural hospitals. That's the issue. And this isn't just anecdotal, right? So all this data is from the 2024 report by the Center for Health Quality and Payment Reform, which is called No Cuts, No Care: The Crisis in Rural Maternity Care. Here is the truth. No OB means no deliveries. No deliveries mean no care. And no care means more deaths. If we don't reform how rural maternity care is paid for, especially through Medicaid, we're going to keep watching hospitals cut services until there's nothing left to cut. So this isn't just a crisis, it's an absolute policy failure. And we have to say it louder: no cuts, no care.